CTV family. Catch us live on your TV screens.
Listen, ladies and gentlemen, when we tell you that we give you new things all the time, even our remixes are changing there by the auto remix. The song goes back on, it goes off, it goes back. We're literally giving you nothing but the freshness. Listen, and we've been speaking, rather having really important discussions about, will you be taking the vaccine? Please do let us know. We want to know all of your real opinions. It is Ekse_live on Twitter, as well as Ekse_live on Instagram, as well as Ekse Live on Facebook. Still joining us are the nurses from Young Nurses Trading, Young Nurses in Daba Trading. Young Nurses Trading. Okay. I'm literally like trading. So joining us now is Uzandile. Thank you so much for joining us. You are the third and last edition. Okay, I heard you in the ad break and I'm going to expose her. She said, no, I want to talk about some things. Please start us off. What is it that you feel like, most importantly, we need to know about why you guys are taking the stance on not taking the vaccine?
Well, we as the Young Nurses Trade Union, Young Nurses in Daba Trade Union, are saying no to the vaccine. First, that might have been highlighted by my fellow leaders here, is that we are not going to be guinea pigs for the government of South Africa. Okay, because they said that they're going to give this to the frontliners. Who did they research it on? They know that a new strain of the virus came out. Did they give any assurity to the nurses that they're going to be getting the virus first? There's a lot of other things that the Department of Health needs to address before jumping to giving nurses a vaccine. Throughout this entire surge of the COVID virus, this fight that the nurses have been fighting, frontliners first facing the worst, and they had addressed nothing. I'm talking about grievances that existed previously before we even had to face the COVID virus. And here we are today. The government just wants to paint it all over on top without fixing what's wrong at the bottom, the foundation of the healthcare system. Looking at remuneration of the nurses. Through all the struggle that we have been through as frontliners, do you think a vaccine is going to provide mental therapy to a nurse who has been witnessing death after death after death? No, it's not going to happen. Do you think a virus is going to re-energize the burnt-out, fatigue healthcare workers that were dealing and are still dealing with this virus?
There's no vaccination for burning out.
There isn't. There isn't. And for us, it feels like the government really undermines the frontline workers without giving them thorough, sound information and developing a sound criteria, because we need to understand that a pandemic is not an emergency. And pandemic is not an emergency. People need to take time, invest in research, invest in thorough planning before jumping to rolling out vaccine.
What about the fact that the World Health Organization roll out as vaccines, iti izokwazi usebenzisana incedise kule variant ibhaqwa apha eSouth Africa? Are you still skeptical?
Definitely. We are definitely going to be skeptical, because in the end, it won't be the World Health Organization that's going to be in charge of the distribution. I mean, you can see right now we have a vaccine that's expiring in over just a month.
Before you say anything further, vaccine expiration. Khanyisa is a nurse that goes to office yakhe. She finds these expired vaccines. Can we check her out?
Whoa.
Hayi kaloku bafazi, impangelo namhlanje. Sibuyele emtebetini. Yo, hayi sana. Hayi shame ibimandi kodwa le weekend kaloku bingathi iChristmas. Yo, ndizawujonga ezilento ke ezi vaccine. Ewe, ezi vaccine. Gladys, kutheni ngaziphelelwe nje? Khawuvele ezi vaccine. Hey bawo. Iwe sokuthengwe i-case lonke lezi vaccine, Thixo wami, sizayithina lento. Cover up. Hayi ke nomgledi, umsebenzi wethu Monday uphelile ke sisi. Ewe, mama elino ngasuyenze wena xela abo bafola i-vaccine lokuba iphelile. Ewe kaloku fini. Ewe hayi kaloku akhona sila uyenza nathi siqeshiwe sithando sami. Ewe.
It's not a funny matter, but it is a funny matter. Follow her on Instagram, Khanyisa_unfiltered. You know us as South Africans, she's on Instagram. You can find a lot of skits as Nzaya. So I thought I should let the viewers know about it this time. Let's go back to expired vaccines.
You can see by the fact that they brought out vaccines without checking the expiry date, it has been evident that our Department of Health fails us when it comes to servicing the healthcare workers so that they're able to provide quality healthcare services to the communities. Now, if we, as the healthcare providers, whose one of the principles for us to practice is advocacy for the people in the community, keep quiet and accept this vaccine, then it says a lot about us. Remember, we need to grow a backbone. Yes, we do want to get a vaccine. We're not saying no, we do not want a vaccine, but we need thorough plans, thorough strategies, and avoidance of making healthcare workers yet again a ridicule joke in the eyes of the public. That's what the Department of Health maintains doing. Because they failed initially with PPE, and now they are using a vaccine to say that they're going to give it first to healthcare professionals. I'll take one example for you. The Minister of Health and his panel chose to address the nation. At what time was the address? What, 7 p.m. A bedside nurse, a patient-facing nurse, works 7 to 7. At 7 p.m., we are handing over at the nurse's station. So who is he trying to address when the frontliners are at work? Doesn't this show you that he is not taking consideration of the actual frontliners? That they make these decisions up there, and then they just think that we as frontliners should just accept. It can't be that way.
Yeah, no, hey, I don't know what to say, to be very honest. But with this expiry date of this vaccine being April and everything like that, I don't understand the process behind the thought as well. I'm not trying to back up the government and say, no, it's okay, it's fine, but also not blaming and saying this and this happened. Don't you think what could have happened is that they ordered this vaccine quite early and maybe delays happened, it got here late, and now it's here and it's expiring? Are we looking at those options as well? Forget the fact that they did not test it in South Africa, but like, can we give them grace? Some kind of grace?
Exactly.
But also I understand what you said, that a pandemic is not an emergency, but it feels like one. We're racing with time. You literally sleep up, you don't know what's going to happen the next day. You can't move. If you're planning on, young people, I know of a friend of mine that was planning on moving to Johannesburg, but they literally cannot move because they don't know what's going to happen tomorrow. Things change in a split second, overnight. So couldn't it be that Ekse, guys, that they ordered this vaccine quite early, and then it was supposed to come whenever it was supposed to come. Ayafika ngoku njengoba ngoku ifika izo expirish.
If this is a government that you trust, why are they not being transparent to say that a vaccine has delayed?
Who came up with the information that the vaccine will be expiring in April?
It's them. They give out all the information regarding that vaccine. But why would they skip such an important or vital piece of information when it arrives? They let us get into an hype, an excitement that we are going to be saved from this COVID pandemic. But still, they still want to test this on nurses.
Viewer, other countries, let's take a look at the US and the UK, frontline workers taking the vaccination. How different is ours to theirs? And if there's no much different, why are you guys saying no to it?
So what we're saying is that the issue here with the vaccine that came from Italy, it is that, one, the vaccine is expiring within a little time, and number two, the vaccine cannot speak to the fact that the new strain of COVID-19 can deal with it. So it might happen that in another countries, maybe the strain that the vaccine is dealing with can be looked at by this vaccine. So the problem is that the strain that is currently now cannot be looked at by this vaccine, whereas maybe in US, the vaccine can deal with that strain. That's the problem that we have here.
And one of some of the things that you do spoke about earlier is that you advocate rather for the community. So now I am a mom, I have these children. Think about the vaccine, not going to take them. What do you advise me to do? I'm not taking the vaccine. Should I stay at home? Should I contain in these areas? But how do I move forward as a person who's not in the medical field? I just hear on TV. If I hear Dr. Zweli saying, go take the vaccine, I might. So what do you advise for all of the mothers out there and the children who are watching this to do moving forward?
When we speak for advocacy in our communities, we want what is best for the community, not to lead the communities astray like the government, not to misinform the community like the government, because it's evident, everybody knows, is that there's another financial agenda beyond this vaccination, rather than the agenda of attending to the communities. Because if the government actually cared about healthcare services and servicing the community with quality healthcare services, they would have made sure from get-go that there is enough personnel, staff, nursing at the hospital to provide healthcare services. Firstly, before jumping to say they're going to give you vaccines, who's going to administer these vaccines when we already have nurses who have died from COVID, whose vacancies have not been filled already, and they are telling people who are on COVID contracts that their contracts are ending. Who's going to administer this vaccine? The same tired, burnt out nurse who is still traumatized by the same virus.
Sure.
So now you're asking these people who are disgruntled by a government to come again and be at the front line to hold our hands and open them up and say, come community, let us give you this thing that the government couldn't assure us works.
We have under 1 minute. When sending your closing statement, what are you hoping that he tells us tonight with State of the Nation address?
On my hopes on the State of Nation address, he will inform us on the information that we need. We will assure us that this virus will work, and this virus, this vaccine will work, and this vaccine, as it won't be harmful to us. And I'm sure we are still waiting for them to come to us. And then now they want to go for the State of Nation address and address them. They must first come to us and address, and they must first come to us and skill us about this vaccine.
From this point on, Ingati, all hope is gone. So we're looking up to you to give us all of Inyani. In fact, we're not looking for information because it could be false. All we're looking for is Inyani because we chose you as our leaders. And these are the frontline workers that we run to when we fall sick. What happens when they are sick? Who's going to take care of the nation?
And I love what they're saying. They're not against the vaccine, guys. Not a we hate a vaccine anthem that's crying here. It's the fact that you need to do thorough work. They want to make sure that us as the community are safe when taking this vaccine. So I just want you guys to make sure that you understand their stance. They're not saying we hate the vaccine. They're saying, okay, vaccine good, but make sure that the vaccine is good for the people.
And they trained as well in order to give out the vaccine. Because, I mean, the vaccine could be good, it could help them, but if you're not training the workers, how are they going to vaccinate people?
Thank you so much for tuning in. Bingo viewers and as well as Usibongiseni, letting us know the ins and outs of their vaccine and where they stand today. Hopefully tomorrow and the day after isn't also busy.
Guys, my hand and go
I feel like we need to invite the nurses to come through later on, in a month or two, so that we get an update.
Especially when the Johnson & Johnson vaccine comes.
Sure. Thank you for choosing us as your source of entertainment. We'll see you tomorrow between 4 and 5. Otherwise, catch this very episode between 7:30 and 8:30 tomorrow morning.
From me to you, it's been all love. The Princess of Presenting is signing out.
I'm saying peace out.
What's your
Adios,
name, Melissa?
amigos.
Picture perfect.
See you when I see you.